As Melbourne comes to grips with living in a second lockdown, there are fears Sydney could follow, with more cases emerging.
What has happened in Melbourne in their particular socially hyper-connected group, the same thing can happen in Sydney through the pubs and the clubs.
The continuing spread of the virus in New South Wales is worrying experts, but some believe it could be halted with a few key measures, like ring-fencing outbreak suburbs and wearing masks.
As soon as the authorities see even a small rise in particular suburbs, they will need to ask that group to be highly compliant with wearing a mask in public, wearing a mask to work.
Already the suburbs of Liverpool and Campbelltown have been singled out by Queensland health authorities as COVID-19 hotspots. Luckily, there are some key differences between New South Wales and Victoria. Unlike New South Wales, Victoria had virus circulating in the community. And there were a couple of very large families exposed to the virus, meaning a lot of people were infected at once. Those differences could mean New South Wales escaped the very large outbreaks we've seen in Melbourne.
I think what the New South Wales Health Department is doing, which is basically finding as many cases as quickly as possible, really good contact tracing, isolation, quarantining, will be effective at basically controlling what at the moment is a spot fire.
Authorities will be closely monitoring how the virus spreads to see whether the measures taken in New South Wales so far are enough. Sophie Scott, ABC News.